operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We have a great program this evening. We're going to be talking with Dr. Sonal Mehta. He's an interventional neurologist with Tenet Florida Physician Services, Advanced Neuroscience Network Physicians, both of those groups, and then also North Shore Medical Center, as well as other hospitals across South Florida that we'll get into as well. Dr. Mehta, welcome to the program. How are you doing this evening?
Thanks, David. I'm doing very well. Appreciate your having me over.
Thank you, and I appreciate you taking us on this adventure of health. Let's get right into it. So, interventional neurology, kind of a newer term in the last few decades, I think, for the general public. But tell us a little bit about what it is that you do.
Sure, I'd be happy to. So, interventional neurology is sort of a subspecialty which overlaps the fields of neurology, radiology, neurosurgery. So what we do in this field is essentially provide minimally invasive procedures for patients who may be suffering from acute, what we call ischemic stroke, where they may have a blocked blood vessel in the brain causing a stroke, or to treat other conditions like brain aneurysm. So these procedures are done with the use of very sophisticated radiology, X-ray equipment, and catheters. And like I said earlier, they are minimally invasive, so you can actually treat complex conditions like brain aneurysms with just small millimeter incisions in the groin area, from where we are able to navigate catheters all the way up to the brain.
That just amazes me. So back in, I guess, the olden days, how did they do it? I mean, they used to go through, I guess, different parts of the skull to...
True. So, obviously conventionally neurosurgical procedures were all done through opening up the skull and accessing the brain. What these interventional or neurointerventional procedures do is provide this alternative for many procedures, many conditions that, 40 years ago, 30 years ago, would have been treated by opening up the skull and doing a complex neurosurgical procedure. Now it can be done with just something that's minimally invasive, where patients can get procedures and have conditions like aneurysms treated and go home almost the very next day.
That's just amazing to hear that. Great news there for stroke care across South Florida and neurological disorders. The technology is moving so fast in the right direction. I really wanted to have you on this show. I know this has been in the works a long time for you, but in June it was shared to the local public. And I have to say congratulations, because you helped North Shore Medical Center in Miami become the first in Miami-Dade County to receive a thrombectomy-capable stroke center certification from the Joint Commission, also in collaboration with the American Heart Association and American Stroke Association. So, of course, congratulations there. I know you worked very hard in the few years you've been here to get that moving. So, What does that mean for North Shore Medical Center? A long history there at North Shore. I think it's over 60 years the hospital's been in that area.
Yeah, I think you're exactly right. It's been about 60 years or so that North Shore has been serving, the northern Miami Shores area. And this certification from Joint Commission, which is this organization that accredits hospitals and programs within different hospitals, to ensure that certain quality is maintained and certain benchmarks are met, means a lot because, as you said, we are the first hospital in Miami-Dade County to achieve this certification, which is to say that we are thrombectomy capable stroke center. The Joint Commission essentially has designated different levels of stroke center certification to hospitals, which are based on the benchmarks they meet for stroke care, their outcomes, how quickly they can provide services, treatments, because stroke is a medical emergency. So time matters, every minute matters. We often say time is brain. So the faster you can administer treatment, the better. So all of those things go into making a stroke center what level it will be. And we were a primary stroke center until about 2 months ago or 3 months ago when we received this next level certification, which is thrombectomy capable stroke center. Thrombectomy essentially means that is the procedure we do, which is this minimally invasive procedure to retrieve or remove blood clots that have traveled to the brain and are blocking the blood vessels, which are preventing blood flow and oxygen from getting to the brain, resulting in what could be a serious or devastating stroke. So these procedures are performed emergently. So for a thrombectomy capable stroke center, we have to perform these procedures and offer these procedures not just as quickly as possible, but also be available to do them round the clock, 24/7. So we have a very dedicated team of physicians, right from the emergency room to neurologists to ICU to internal medicine specialists, but also our other team members who are making this program a success: nurses, nurse practitioners, radiology techs. They all play a significant role in us being able to achieve the certification and provide this sort of next level of stroke care to the community that we serve.
That's great. And yeah, you mentioned time is brain, another term that's come into the forefront as well. Tenet Health and the Advanced Neuroscience Network does a great job with this, amazing numbers over the years, door to needle time as well. So that's really huge. So again, yeah, congratulations. That's amazing. And yeah, keep up the great work. I actually met your team a few times. I've never seen you actually in action because I'd have to be in the interventional room. But it's an amazing team and what you guys have done and gals have done in just the last few years. So congratulations again.
Thank you. Appreciate it.
Let's go a little bit into some of the tools you talked about going into the brain and, grabbing a clot and pulling it out, which actually, like you said, will give blood flow again to the brain. And hopefully, that person can start the recovery process without losing too many brain cells from the stroke. But what are some of the mechanical endovascular tools that you use? Because I know a few years ago that lot was like the solitaire pipeline device. I know I had Dr. Mueller on here talking about that probably 3 or 4 years ago. Is that still in the play? Are there other tools?
It is. So essentially we kind of have two sort of categories of tools at our disposal when we are talking about retrieving clots from the brain, for treating somebody who's having a stroke. One is these thrombectomy devices, solitaire being one of them, which are essentially kind of like stents, which almost snare the clot and allow you to retrieve it. And the others are essentially what we call aspiration catheters, which is very thin, flexible tubes, catheters, which you can navigate all the way up to the brain. And then, to put it crudely, basically just suck the clot out of that blood vessel. And these, both of these devices have been really kind of game changers in the field in the last, 4 to 5 years or so, just about 6-7 years ago when I was starting my fellowship, many of these devices were not even available, and now they are, and they've completely changed what we can do for these patients, and also more importantly, how quickly and how safely we can do it.
That's great. Yeah. So again, we're here with Dr. Sonal Mehta. We're here until 6:30. Numbers 888-565-1470 if you have any questions. Dr. Mehta, like I said, is on staff at North Shore Medical Center. He's part of Tenet Florida Physician Services and the Advanced Neuroscience Network Physicians. You also are on call at some other hospitals. I just found this out this week. I had no idea, because I know you from when we met and how much time you spent at North Shore, and people think, oh, doctor's on call, Dr. Mehta may be on call for a 16-hour day. That's not the case. It can be much longer days, but you sometimes cover your colleagues.
Right, and we have I'm very fortunate to have really good partners and really good colleagues, Dr. Cueva and Dr. Kaushal, who are based at Florida Medical Center and Palmetto General, respectively. And the big challenge about offering these services is that you have to be available all the time, 24/7. Because strokes are not scheduled. They can happen at any time to anyone, and we need to be available. So the only way to really be able to do that is by collaborating with each other to ensure that, all of us work well with each other. We cover our respective hospitals, but also cover the other hospitals when they need coverage, so that all of us can also get some time off every now and then, which seems to be rare, but I think our system's working well.
Nice. Yeah, I've had Dr. Kaushal on here a few times, and Dr. Mueller up north. I'm working on Dr. Cueva, so I'm really interested in talking to him. But it is an amazing team, the Advanced Neuroscience Network here in South Florida, part of Tenet Health's 10 hospital system. We have a couple more minutes before we got to take a quick break, but I want to give out the info. So Dr. Mehta, he's worked very hard at building this thrombectomy capable stroke center with his team, but he also has a practice in Miami. It's 1190 Northwest 95th Street, Suite 404. It's right there on the campus of North Shore Medical Center, so it's right in front of the hospital. 786-502-9196 is the number as well. So I'll just read through your areas of interest really quick here, and then we can go into a little bit more. So vascular neurology, endovascular surgical neuroradiology, neurointervention, neurocritical care. We talked a little bit about acute ischemic stroke, carotid artery disease, and carotid stenosis. That's the artery in the neck that can become clogged with plaque.
That's exactly right. It's a common location of cholesterol buildup is the carotid artery here in the neck, which then travels up to the brain and can be a significant risk factor for stroke.
So you treat those cases as well with the catheter-based treatment?
Absolutely, and as a stroke-trained neurointerventionalist, I can kind of have the perspective of offering both medical treatments, as not every blockage needs to be fixed and can be treated with medications, but when it does, the options are either to do open surgery and have a surgeon essentially kind of clean out that plaque, remove that plaque, or to do a minimally invasive procedure by putting a stent into the blood vessel, similar to the way people have stents placed in their heart, except this one goes into the carotid artery and opens up that blocked blood vessel. So it's really sort of on a case-by-case basis that we determine which one might be better for each individual patient.
That's great. And also cerebral aneurysms, we talked a little bit about that. That's the brain bleed?
Correct. So, brain aneurysms are not always aneurysms that bleed, but when they do, it is a very serious condition and carries a very, very high mortality. So sometimes we may find brain aneurysms which haven't yet bled but are causing other neurological symptoms like headaches, and even those may require treatment. And those can also be treated in a similar minimally invasive fashion by either putting what we call our coils, thin wires of platinum into the aneurysm to block it, plug it up, or to put essentially a stent-like device that allows the blood to be diverted from the aneurysm into the brain. So those are both options we can talk more about later also.
Yeah, so if definitely if someone, a friend or family member who's having some issues, check out the FAST acronym, face, arm, speech, and time. If you have someone, get them to, of course, a medical center. But Dr. Mehta is an expert in treating, these types of ailments, neurological disorders. At North Shore Medical Center is where he spends most of his time. It's northshoremedical.com, 305-835-6000. You'll recognize that name. We've had a lot of doctors on from the show. Even the CEO made an appearance last year. So a great hospital, 1100 Northwest 95th Street, Miami, right off the I-95 exit there of 95th Street. Let's take a quick break, and on the other side, I want to ask you a little bit about the difference between, ischemic and hemorrhagic strokes on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, everyone. We're here with Dr. Sonal Mehta, Interventional Neurologist, North Shore Medical Center and Tenet, Florida Physician Services, and the Advanced Neuroscience Network Physicians across South Florida. Oh, so before the break, I wanted to ask you, is a thrombectomy, so you guys at North Shore and gals at North Shore Medical Center are a thrombectomy-capable stroke center. Is the thrombectomy for the ischemic, the blood clot, and correct me if I'm wrong, or the hemorrhagic stroke, which can be a bleed or similar?
Sure. It's important to understand the distinction between ischemic and hemorrhagic strokes. They look the same. So when somebody is experiencing a stroke, you can't tell whether it's an ischemic or hemorrhagic stroke. But
I didn't know that.
They're fundamentally very different in the sense that I always like to go back to a very simple plumbing analogy. So ischemic stroke is essentially the equivalent of a blocked pipe. So when if you're plumbing, if you know about plumbing and you have a blocked pipe, that's what happens in an ischemic stroke, because a blood clot may form or may travel to a blood vessel in the brain and block it. And that does not allow blood and hence oxygen to get to that part of the brain. And that part of the brain will then suffer injury and damage and have and be affected by a stroke. Now, this is the one where we say time is brain, because every second, every minute that passes by, more and more brain cells get affected until all the brain cells that are in that particular part of the brain will then die. Every minute that goes by, almost 2 million brain cells are affected. So this is the kind of stroke where we can really make a difference in how that patient, how that person will recover by acting fast. And these are the majority of all strokes, the ischemic strokes. There are about 85% of all strokes are ischemic strokes. It is for these strokes that we do the thrombectomy procedures that we discussed, which is basically going in with a catheter and a device from a blood vessel by the hip in the groin area, going all the way up to the brain, removing that blood clot and restoring blood flow to the brain. The other 15% or so of strokes are what we call hemorrhagic strokes. And here the plumbing equivalent of that kind of is a burst pipe, where there is leakage happening because the pipe is leaking. And this can be from multiple different causes, the biggest one probably being uncontrolled high blood pressure that can cause bleeding in the brain. The other big cause of bleeding in or around the surface of the brain is brain aneurysms, where again, what we were talking about earlier before the break was that this is again something that we can now treat minimally invasively through these interventional techniques, go in with a catheter and essentially plug up those brain aneurysms, treat those brain aneurysms, and prevent them from bleeding again, because an aneurysm that bleeds once carries significant risk of disability and death, but an aneurysm that rebleeds or bleeds again, that risk is just tremendously higher. So that's something we want to prevent at all costs.
That's great news, Dr. Mehta. Again, we're here with Dr. Sonal Mehta. So I wanted to also ask you about some community data. So with the thrombectomy, that seems to be more the common, the ischemic stroke. So I think you've already built some data. So if you'd like to share that with us, that'd be great.
Yeah, sure. So I mean, the important things to know for members in essentially any community is, first things first, everybody needs to know what stroke symptoms look like. So here an easy acronym that you referred to earlier is FAST. So FAST. So it's a simple thing to remember. The F stands for face. So if you see somebody with a suddenly drooping face, where one side of the face is drooping, the arm is to see if they're able to hold their arms up, or if the arm is weak or drifts down. The S stands for speech. So if they slurring their words, or not able to speak properly, or not able to understand speech, if any of these symptoms are present and they came on suddenly, it's very likely that this person's having a stroke. And then the T tells you that it's time to call 911, and it should not delay. So first and foremost, everybody needs to know these symptoms, and they need to know what to do if anybody around them experiences them. So you need to call 911. And then you also need to know, I always tell patients, family members of patients, to know what the stroke centers are around them, where they would want to go to be treated, because every stroke center can offer the same treatments, but they may vary in how rapidly they can offer them, or how their outcomes are. And these are things that can make a big difference. Even a difference of a few minutes can make a big difference. So, we are at North Shore have been very proud of our treatment times over the last, year and a half or so that we have been doing thrombectomies. And especially over the last few months since we became a thrombectomy capable stroke center. So, we offer both treatments, one being a potent clot busting medication called TPA, which is, again, to come back to the plumbing analogy of stroke, it's kind of like Drano. It's something that's given through the IV, and the idea is that medication enters the bloodstream, breaks down any blood clots that may have formed, and then certain patients may, in addition to that, benefit from thrombectomies, or may not be a candidate for that blood thinner, but may be a candidate for thrombectomies. So both these treatments need to be offered, and need to be offered as rapidly as possible. So our goal is to, for any patients who come in, from the moment they get to the hospital to actually starting to get this treatment, is to be done within less than 30 minutes. And that means that they have to get a CAT scan. The CAT scan has to be looked at. They have to be assessed by the emergency room physicians. They have to have blood draws, labs, x-rays, multiple things that happen within that time span. But it's a very fine-tuned process that we have now developed, that we are very proud of. And for also for thrombectomies, for patients to, from the moment they get to the hospital to actually being in the interventional suite where we do these procedures and getting the procedure started, has to be done very rapidly, and we're doing it routinely within less than 60 minutes, sometimes as low as 15 to 20 minutes even.
And each minute, like Dr. Mehta said, saves up to 1.9 million brain cells.
Absolutely.
That's huge. Hard to believe we're almost finished here, but we'll have to have you on in the future. Again, it's Dr. Sonal Mehta. He's with North Shore Medical Center in Miami. He's also got an office there, 1190 Northwest 95th Street, Suite 404, 786-502-9196. If you want to learn a little bit more about him, there's a profile at tfpsdocs.com. We have that last minute. I wanted to ask you my curveball question. What are your hobbies and passions in life outside of medicine? I know you're very busy, but
so I've always been a big sports enthusiast, so I really enjoy soccer. I used to play a lot, but now I don't really get a chance to do that, so I really enjoy watching soccer. I really like tennis, and since both my wife and I are relatively new to the South Florida area, so these days we're just enjoying exploring new areas, new neighborhoods, new restaurants. We're enjoying life here so far.
It is a great area. I don't know any better because I've been here my whole life, but hey, enjoy it. Thank you for all the info, and let's have you on again in the near future.
Thank you.
We'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions